What is the best exercise to reduce pain from arthritis? This is a huge question. So many people have such severe arthritis that it limits their walking and limits their independence. There have been a lot of studies over the years that ask the question, what is the best exercise or what's the best activity to reduce pain? And they've studied everything from weightlifting to aerobics to walking. You name it, there has been a study that's looked at that as to whether it's an effective way to reduce the pain from arthritis. So if you look at all of the recent research articles, so the ones that have been published all in the last 4 or 5 years, what you're going to notice is that most of them have found that a combination exercise that includes strengthening, endurance training, and range of motion is much more effective than exercise that just includes one of those. So what several studies have shown is that when you just do weightlifting, that definitely can reduce arthritic pain, but that's not as effective as an exercise that includes range of motion or stretching, strengthening, and endurance. So things that are like that, the exercises that are like that are aerobics, group exercise classes. What you want to find is something that you can do on a regular basis. Most research has shown that doing these type of exercises is only really effective if you do it for more than 3 months and if you do it every day. So the problem is for a lot of seniors, they don't want to leave their homes, they're not comfortable going to a yoga class or group exercise class, or their pain is so bad that they just can't consider those as options. So for that reason, the exercise that I recommend to anyone over any other exercise is a stationary bicycle. Using a stationary bicycle has a lot of advantages. First of all, it definitely allows you to have an exercise that includes strength training, stretching and range of motion, and it improves your endurance. So it meets those criteria as what we now know are the best things to help reduce pain from arthritis. But also, there's a lot of advantages of a stationary bike. First, you can do it inside your home. You don't have to leave your house to use a stationary bike. There are many types of stationary bikes. There's the sit-on-top stationary bike, which we're all familiar with. There's another kind called a recumbent bike. There are also something called a restorator, which is a portable bicycle that you just sit in a chair and you put this in front of you and put your feet through the straps and you can pedal. Some of those are as simple as just an axle and 2 pedals. Some of them are as complex as the insides of any stationary bike. It has a flywheel and everything else, but it's portable and it's small. So the reason that these are so helpful to people is that you can do them at any time of day. You can do them in the comfort of your own house with your air conditioning, or you're out of the rain, you're out of the elements. But the biggest thing is there's no real risk of injury when you use a stationary bicycle. You really can't fall off of it. If you have the kind that sits in front of your chair, there's just almost zero risk of injury in using this. And that's very important, because the problem with a lot of exercises that the research has been shown to be effective on, they're dangerous. There are many research studies that include putting ankle weights and arm weights on people and having them do exercise. The problem is a lot of older people are highly at risk for falling, and doing something like that can just make it worse. So if you look at all the exercises available, all the exercises that are out there that can help with arthritis pain, a stationary bicycle is by far the best one. Now, I know that not everybody who's watching this video is going to be able to do this. I've definitely had patients over the years that their arthritis was so severe that they couldn't do the stationary bike. In fact, pretty much every day I see people like that. I would recommend anybody, before they start an exercise program, to talk to their doctor and consult with the doctor as to whether doing the stationary bike or doing any kind of exercise is good for them. But if your pain is that bad that you can't pedal a stationary bicycle even one time, that's probably a reason to talk to the doctor to discuss what options you might have. I can tell you, if they clear you for the stationary bicycle, but you're still finding that you can't do it, it's fine in the beginning to do like a half pedal, where you use the stationary bike and you only pedal it halfway through the range of motion and then back pedal the other way. Sometimes if you do that, a minute every day for a week or so, you'll find that you are able to pedal all the way through. So to use a stationary bike effectively to help with arthritis pain, I recommend that you start with just 5 minutes. So you get your stationary bike, whether you're sitting on it or it's sitting in front of you, put your feet through the pedals, no resistance at all. To help with arthritis pain, you really don't need resistance, especially in the beginning. And then you just pedal the bike as slowly or as quickly as you want for about 5 minutes. And then every time that you use the bicycle, you try to increase the time that you're pedaling by about a minute. So if you start off at 5 minutes, the next day 6 minutes, maybe the next day 7 minutes, a couple days later you're doing 8 minutes. You want to build up until you get all the way up to 20 to 30 minutes. Ideally, the research shows that 20 to 30 minutes of moderate bicycle riding is highly effective at reducing your pain, reducing your discomfort, improving your range of motion, and it definitely can affect your walking. So much so that there's many clients that I see who have arthritis pain that I tell them, get one of these stationary bikes and do this every day. Do it the days you don't come to therapy, do it the days you do come to therapy. Just do this every day and let's see how you are. And so many people that I've seen that are able to do this, that are able to use the stationary bike, they find that they can walk with less pain. It reduces the pain some. It allows you a little bit more range of motion. It helps you build your strength just a little bit more. And that can make a huge difference to your function. Please subscribe to my channel if you like this video and want to see more things like this. Also, if you look in the description, I have a list of other videos I think might be helpful.